Morning. I was thinking this weekend, we don't talk enough about moral injury and healthcare workers. Moral injury itself is not a mental health condition. Like morals can be loosely defined as the set of rules or guidelines that we live by that personally, we individually believe make a good life. And healthcare workers are people who have dedicated their lives for whatever reason to being helpers. That's what the job is. And working in a system that has us, had us make choices about who we could help and not help, despite having the skills to do so, like being fully able to do so. When the will and desire was there throughout the pandemic, it was really obvious the impact that it had on healthcare workers, causing harm to healthcare workers themselves, right? There's lots of research done on that at this point. With the last year, everything kind of really improving in that way. For people who work in hospitals, there's still some stuff, but for the most part, we've really come out of that time, and that's breathed much relief into a lot of the parts of the system that, after being basically ground to a halt, started moving again, allowing us to get back to what many of us feel we were born to do. A lot of us, I think, hope with the systems that, are there, knowing that despite the challenges we face, we complain about that. You guys have heard me talk about that kind of stuff, that one by one, we're still helping to make a difference in people's lives, right? At the end of the day, I go home feeling still good about myself and the work that we do. One of the things that's really hard when you can help a lot of people that you would have never met had you not had this job, like it's really wild, is when you realize there's still a lot of people in your inner circle or extended circle that you just can't help for a lot of reasons outside of your control completely. Even though you have the skills, even though you know what to do, even though you have the ability to help them, not only are we not supposed to help them, but we just can't. And it's probably, I started thinking about like what a cancer doctor might feel if a loved one not only gets cancer, that's not unreasonable, but gets the cancer type they're specialized in. And after some treatment or all treatment, all of the things, or maybe not even being able to access all of the things for whatever reason, they lose that person anyway. And the level of helplessness and sadness and despair that can ensue, right? That's moral injury. It's like watching a train wreck. You feel helpless to prevent, even though you know exactly what button they're supposed to push to stop the train wreck from happening. We should talk about it more. That's all. Who's in?